Question is, do y'all still use lithium? So the answer is yes. The longer answer is it's kind of complicated. So when it comes to medicines, medicines are very interesting in the world of psychiatry. So I always, and the doctors at Mindful, so Mindful is the private practice that I own, and I work with lots of other doctors. And if you want to learn more about them, go to www.findmindful.com. So we try not to use medicines at all. Okay. So that's the ideal situation is don't put anybody on medicines. But we are trained to use medicines responsibly if we need to. And lithium is one of those medicines where you have to use it very responsibly. So lithium, we spoiler alert, we don't actually know how it works. Wah, wah, wah. And why do we use it? Well, because it works, but we don't know how it works. We have some hypotheses, but in general, we generally use lithium in psychiatry for acute mania, which is a fancy doctor term for you are having difficulties with your thoughts racing, you're talking really fast, you feel very grandiose, like you feel like you're on top of the world. Your mood can be very labile, which is where it goes up and down and up and down. You can your thoughts get very just kind of jumbled, and sometimes you can even detach from reality. You have a difficult time distinguishing kind of what's real and what's not. And in the face of something that extreme, sometimes it's really, really helpful to be on lithium. So lithium is technically a salt. It's on the table of elements. I can't remember what number it is. You'd have to look that up. But it works as a what we call mood stabilizer. It brings things instead of doing this, it brings things more within that kind of normal equilibrium. The key to lithium, though, and one of the hiccups with lithium is you have to check a blood level because there's only one organ that changes, metabolizes lithium, and that's your kidneys. And so most other medicines you take, your liver cleans it and scrubs it and makes it inactive and all this kind of stuff. But you're not for lithium. Lithium is only excreted by your kidneys, unchanged. It just passes through. But the problem is if you have any kidney disease, it can create a clog and a backup of lithium. And if you get a backup of lithium, it is not very pleasant because you start to see like halos around lights and you get really jittery and you can start losing your hair and stuff like that. Again, that is not very common, especially if you get a blood level. And so the key is keeping in mind that whoever prescribed you lithium is going to ask you to go get some lab work. That is standard of care. And so if you hate needles, I'm sorry. I don't like needles either. Don't like having my blood drawn. It's not fun. But we also want to keep you safe. And so the key is you get a blood level after you've taken your lithium for the day to see how well you are getting rid of it. And if it's too high, we can adjust it. And if it's too low, we can adjust it. But the key is we want to dose to effect. We want to make sure that it's within the therapeutic levels while it's also working. And so whoever your physician or nurse practitioner or physician assistant is, they will walk you through all of that. But yes, we still use lithium. It's very common for mania, for use in mania. There are some psychiatrists who will use it. There's something called off-label use, and actually we'll have a whole other conversation about off-label, but for agitation and aggression, sometimes lithium can be helpful. Again, if you're on it, and you're like, wait a minute, I don't have mania. Well, talk to whoever your prescriber is, and they can walk you through why they put you on it. Because it's a very safe medicine, very effective medicine if used for specific purposes. So that is lithium.